Hello everyone. Today Figgy's going back to Nashville, and we went last week, so this will be a kind of a 2-week update, or a 2-part update. Last week when we went, we didn't get great news, so the vet called, and I don't have that audio because I had to take Aiden to his doctor's appointment in between Fig's appointments. So basically what they said when they called was that we had not only a significant increase in the size of the nodules we already had, but also some new nodules. We had also seen that lump on his neck kind of separate from one into almost a 3-part. They're all kind of attached, but it's still 3 parts. It's hard to explain. But I do have the audio from when I went to pick him up after. So when they called, she said, I'd like to do blood work, x-rays. He was having some trouble getting around. I was having to lift him with, some sort of stability support in order for him to get in and out, to go to the bathroom for a couple days. And he was definitely showing some pain on that one leg. So I asked her, can we check and make sure the cancer's not spreading there, or arthritis is really kicking in, or, is there anything we can do for him due to him not wanting to use, it's not even not wanting to use, it's just seeming to have the inability to use that leg the way that he was in the past. So we checked all of that. They re-x-rayed his, they did the chest x-rays prior, obviously, to calling me. So he had a full workup, and I'll put the discharge instructions in here so you can actually read what was done. And they started him on a new chemo, which is a considerably stronger chemo. Same kind of side effects, just obviously the stronger the chemo, the more likely and potentially more severe the side effects. But that was our real only option. The other one wasn't seeming to be effective anymore at all. So we went ahead, we had that chemo done. He tolerated it well. It's been 1 week. He did have, so I'll precede this by saying, I did begin fasting him. I'd been doing some research on fasting, and I did begin fasting him about 18 hours prior to his chemo treatment, but I didn't tell them that, which was my mistake, and they ended up feeding him while he was in clinic there. So that broke that fast, but I did fast him again once he got home, and I did a full 72-hour fast with him post-chemo, because I had been reading that sometimes the fasting can reduce the side effects. He did not have any vomiting, diarrhea. He seemed himself. He was looking for his treats, because he gets his treats every night, so he gets a bully stick every night. He was kind of confused as to why he wasn't getting that, but other than that, it was good. He was still having a lot of trouble getting around on that leg, so she did add in gabapentin along with his Rimadyl that he's on for pain, and I had started him on that. The crazy thing is, through that fast, I was still kind of having to help him go outside, and then when we broke that fast at 72 hours, he almost instantly the next day just started using that leg. So whether it was the pain meds kicking in, the results of the fasting, I have no idea what it was, but he's been using it ever since, and he's been going out in and out on his own again. This morning he even took off, and I think either Nika or Bushi are starting to come in to eat, and he was, last night and today, he was all the way at the back fence, which is quite a distance, especially for him. It's probably I don't know, it's longer than a football field. So anyway, it's a big run for him, and he was out there just cruising around with the girls and didn't even seem to care. So I let him in the house, tried to let him cool off a little bit, because for some reason it's only showing 90 today, but it feels real hot. I don't know if it's the storm coming in or what, but we do need the rain. So a little off topic there, but we do hope we get some of this rain coming in. It'd be great if it didn't affect baseball, but it is what it is. So I got him cooled down a little bit in the house, got everybody else out, and him loaded up, and we are on our way now. Today they're checking blood work, so I'll have an update for blood work after we're done today, and that's just to make sure that even though physically he seems to be tolerating it, we want to make sure that everything internally is tolerating that chemo as well. He is not been changed on his diet. He's still eating a raw diet, low carb, high fat. He's on his pain medication, so he's on the Rimadyl. He's on now the gabapentin. He's on 2 of those twice a day, 1.5 of, I want to say they're 500 milligram, I don't have them in front of me, of the Rimadyl. He is on his mushroom tincture. He's on the turkey tail mushroom tincture. And I give him 3,000 milligrams of vitamin C. I did discontinue the Ivomec because what I had read was 30 days on, and he did at least 30 days, so I'm going to give him a couple week break, and then I think I'm going to put him on a dose. I need to do some more research, and it's real hard to figure out exactly where the dosage needs to be on some of these alternative therapies. So I don't know if I start the same dosage again and do that for another 30 days or what. So I do plan on implementing that again, but I'm not sure if it's going to be more of a once a week thing or an everyday thing. I know it tastes like crap and he hates it, but if it helps, we don't really know. If it helps, I'm going to give it to him, or at least try. I did add in an herb, and I'm not really sure how to say it, but it smelled like sarsaparilla, and it's supposed to be an anti-tumor. And I get it from the place where I order some teas from, and it just comes as a loose herb. And the great thing about it is you don't have to brew it into a tea. You can just feed it raw as well, without having to boil it or cook it in any way. So I give him that. I take it myself as well, but I give him that, and that's really the only new thing I've added into his thing besides him being on a new chemo. So we'll find out today if his blood work is good, and then if it is, in another 2 weeks he'll have another dose of that chemo along with another set of x-rays. He's very rarely coughing. Like he went out, ran around, and came in. He wasn't coughing at all. Was he winded? Yeah, but I mean, it's 90 degrees, and he ran quite a bit, considering he has a little bit of trouble getting around now. So he's still himself. He still is, pawing when he wants attention. He's asking for, I have to tell him, don't climb the stairs. Stay there. I'll come right back. He still wants to follow me everywhere. So he's still happy. He's not lost any quality of life. That I don't feel like he's lost any quality of life. Yeah, he did have a good week there where he was having trouble getting around, but he was still in great spirits. So all it took was me getting a little sling and kind of helping him in and out, and then he would go outside and go to the bathroom. That was also his roughest days, where I would say like the day of chemo and 2 days after, and that was during that fasting period as well. So I'm going to continue fasting him, doing a fast once a week with him, and see if the research I've been doing on fasting is saying that the fasting allows the protection of the healthy cells while it kind of kills off or doesn't protect the weaker cells, which would be the cancer cells, and kind of allows the chemo to penetrate those a little bit more while protecting the healthy cells. So whether it works or not, I have no clue, but you can come along this journey with me. I'm also researching into some newer foods. Where are these cancers coming from? I think I talk to about 24 people a week, and the scariest thing to me is that I would say 70% of people who are inquiring on getting a new puppy, filling out applications, all breeds, all ages, all over the country. They have either had a dog that they've lost to cancer or are in the process of. All the different foods that people are feeding, one of which is, I know, on Farmina, and that is not manufactured in the United States. It comes out of Italy, and they don't allow a lot of the crap in their country that we do here in the States and some other places that manufacture dog foods. So that particular dog, I can't find a food But I've read so many blogs and posts about people who feed raw, people who feed raw with vegetables, raw without vegetables, people who feed only vegetables, and the dogs on vegan diet, and and these are raw organic feeders. Still, dogs getting cancer on these cancer boards. So I can't find a food correlation, but what I'd like to do is dive into the food, and where my research is heading right now is I'm trying to find healthier foods to strengthen the immune system, because if we can't prevent the exposure to the carcinogens that are causing these cancers, maybe we can strengthen the immune system to help the body fight them off. And whether it'll work or not, I don't know, but it's the only thing I can really think of to kind of implement throughout our puppy families and put out there as education for anybody with any breed of dog, whether you're going through cancer or just simply trying to prevent it. So anyway, we'll be at the vet in about a half hour, and I'll have an update for him, and hopefully everything will be great with that, and then we'll have another update in 2 weeks. Every time I get extra time, I just kind of sit down and try and do research. I have a meeting with a couple different companies that produce alkaline diets, and supposedly diseases are not supposed to be able to survive in an alkaline environment. So that's something that I'm interested in as well. But stay tuned. Never know where this rabbit hole is going to lead, but as of right now, Figgy's doing good. He's happy. He's himself, and that's all I'm asking for at this point, is for his comfort. So thank you for staying along our journey with us, and we'll have another update later. Well, I'll put that update in here, but the next update will be 2 weeks.
So everything went great.
Okay.
Blood work looked fantastic. His screening of his heart was flawless, so everything looked great. Let's decrease the carprofen back down to 1.5, and we'll see if the gabapentin is helpful for him. We'll start it at twice a day, but you can give it 3 times a day if you need to for the gabapentin. Okay. Sending you home with some more anti-nausea and anti-diarrheals, and we will plan on seeing you back next week.
Okay. What for today? Can he eat normal diet?
Yeah,
Everything's okay.
Absolutely. His tummy has been grumbling.
Yeah, I didn't feed him. I never feed him when he comes.
And he's been having some farts.
Always does.
So if you see any diarrhea, go ahead and just give him his meds. And if you think he's nauseous and he's not wanting to eat a soup, go ahead and give him an anti-nausea med.
Okay.
But I don't expect usually to see any of those signs for at least 48 to 72 hours. But those medications are very safe, so you can give them more if you need them. Okay.
Okay.
Okay. All right. We'll have you schedule.
So with how we're seeing this progression, how do you expect this to work as far as hopefully slowing it down?
I mean, I've seen it work where it's actually shrunk some of the nodules. I've seen it work where it just stabilizes things. I'll be very upfront with you. We're probably looking at 4 to 8 weeks, depending on how he does. But again, he still isn't really showing any signs that things are going on in his lungs. So, I mean, he coughed, I think, once for us today. So it's really going to be dependent also on what threshold he reaches to where he's going to have more and more respiratory signs.
Right.
And that's really going to be the life-limiting factor.
Now, if I'm giving him that Ivamec as a, I guess, prophylaxis, right?
Sure.
Can he be on that with this, or is there, okay.
Should be fine.
Contraindications with the mushrooms or anything
Nope.
like that? Okay, good.
Okay.
And then how often are we doing this?
Every 3 weeks.
And you want to see him back in a week for?
Just to make sure that those white blood cells don't drop significantly to where we need to add in antibiotics or change his dose next time.
Okay.
If everything looks good, then we'll just see him every 3 weeks.
Okay.
Okay.
So we'll do 1 and then 2 from there. So I'll make an appointment for 1 week and also 3 weeks.
You got it?
Okay.
Okay. All right. They're going to bring him up as well as the medications and go over those with you a little bit. I'll make sure we get this in today, though.
Okay.